this is Dr. Alan Barnes with Heritage Spinal Care, and he's a NUCCA chiropractor and a really important member of my medical team. Thank you for letting me ask you some questions today.
Absolutely, absolutely.
Can you talk about what is NUCCA chiropractic?
Well, NUCCA chiropractic is a specific approach to balancing the spine. So NUCCA chiropractic is looking at making sure that the frame of your spine is balanced all the way from the head to the toe, and looking at making sure everything moves in a nice fluid motion, and it's done in a very, very accurate, very specific adjustment to the spine. We're actually correcting the position of the spine to where it was originally intended to be. What I like about NUCCA is the amount of control that we have in balancing the spine. We find that by coming from the top of the spine, by coming from the top of the spine, we can really have a large effect in balancing the hips and everything back to a very, very stable position. So I find that it holds for a really long time. It's very well accepted by the patient, and it's a very gentle and enjoyable procedure all around.
Yeah, I have something to add to that. That definitely, I've done all sorts of chiropractic work in the last bunch of years, and NUCCA is my favorite by far. And a huge part of that is the fact that he's like, you're laying on a table and he's like barely touching your neck. Like it's barely touching it. And other people are like yanking your head, doing all this stuff, and that just doesn't work for me. And NUCCA, he's barely touching you, yet I'll go home and feel that like everything is changed. What conditions do you treat the most?
Well, that is an interesting question. And so I'll first answer that directly in saying that I don't treat anything except a misalignment in the spine. When if there are symptoms or issues within the body that people are looking to have resolved, if it's related to a misalignment in the spine, then I can help. Mm-hmm. So I first look to see, is there a misalignment that's making it harder for the body to heal, repair, and maintain its body systems? And we correct that. Now, what I find is when we correct those misalignments and using the NUCCA method, because we're working so closely with the neurology of the spine and the brain in balancing the body, we find that musculoskeletal things will respond really well, like back pain, neck pain, etc. But also, when we relieve the stress on the nervous system, there are a lot of other neurological issues that show up. Depression, anxiety, those are some things that respond really well. Headaches, obviously. There's just a wide range of things, because if it's related to the nervous system, then we can help. And if that nervous system is affected by a misalignment in the spine, absolutely, that's in our camp.
So what should a person expect if they come to start having appointments with you?
Well, the first visit is we always first determine, can you be helped in our facility? I think that's the only way a health professional should act, is determining first, can the person be helped with what we do? And so the first thing we do is check your posture, because posture is the window to your inside structure. Again, it all comes back to the balance of the frame. If there's a misalignment, it changes the way your body balances, which changes the way the brain has to work to keep you in motion. So some of that takes over body systems and healing repair, right? So we'll first look to see, do you have a misalignment in your spine? Then the next thing we'll do is, if we determine there's a high likelihood that you have a misalignment, we'll look to see how is that affecting the nervous system. So we'll do a scan that shows us the levels of where there's interference in the spine, how severe that interference is, and then we can start to kind of see, here's some of the symptoms that you're having that correlates with what we find in the scan. It also shows us your muscle pattern, because when the frame is off, the muscle pattern's out, which also steals energy and creates discomfort. Then the most important thing that we would do, and this is all in the first visit, is that we would take a set of x-rays to see, how do I unlock the stress that your spine is in? Where is the spine sitting out of position, and how do I come and gently correct that position right back down the same pathway it misaligned, so that way we're not causing any additional trauma in any way. And that's the first appointment. And now, and getting a good understanding of where they're coming from and what's happened, how long it's been there, those are all important questions as well. And all of that takes generally about an hour. Then the second visit, it's usually about an hour. Sometimes we can shorten that if things go really well. But then we'll do the adjustment, and then we do, which is really unique to NUCCA also, we'll do all those measurements again immediately after. So I'll take another set of x-rays and I'll do another scan so that we can see that the nervous system is responding and that it's correcting the way that we anticipated. Once we know how your spine will respond to the adjustment, once we know that things are turning on, then we just run with it and we give your body a chance to heal and repair. Those visits take about 5 to 10 minutes. We keep it short, we keep it brief, and we get done what we need to do and then get you back to your life. That's our goal. We want to make sure that everyone gets back to their life the way that they want to live it.
Totally. Also, so it might be something that everybody's different, but when I first started, I think I was coming twice a week. Did we start doing that? Is that normal when people start with them twice a week and then you phase it out, or does it totally vary?
It really depends on the person. A lot of times I try to start once a week, but I don't want to miss and not give them the right amount of care that they need. Twice a week is some people I'll start at twice a week, that all just depends on the person.
So can you explain about this graph on the wall behind us?
Yeah, there's not a whole lot of special about the graph, other than that it shows me. It's a really helpful tool to look and see where is the misalignment in your spine. I can see which shoulder's high, which hip is high, and is there a twist in the spine. We use those graphs. They're just horizontal and vertical lines, but they're segregated to tell me how many degrees of twist is there in your spine. So by starting with that, I'll use that before and after every adjustment so we can see where you're starting from. And probably its most useful tool is telling me when you don't need an adjustment. If you're holding your alignment, then we don't want to change anything because you're in the position where your body needs to be.
Yeah.
And so, but then if you do need it, it also tells me when the adjustment's done. When you're balanced and when you're level, that's when we're done. We don't stop when we feel like it's right. We stop when we know it's right.
Where can people learn more about NUCCA?
NUCCA.org. That's NUCCA.org. That we've done a lot of research, a lot of studies in understanding how this work affects the body and what things that it's shown to help with. There's a huge list of things, and they'll find a lot of that. If they're really heavy into research, there's a tab for them there. If they just want to understand, can they be helped and see other people that have been helped, they'll find that also.
So thank you so much for letting me ask you some questions about NUCCA. And I'm really excited for other people to learn more about it because NUCCA has helped me in so many ways, and it has been a really vital part of my recovery experience.
Absolutely.